looks like we've got a large group with us, so I'm going to go ahead and kick things off and welcome everyone today to our congressional briefing on focused ultrasound therapy. We are so pleased to have you with us this afternoon. My name is Katie Collins, and I am the Director of Government Affairs at G2G Consulting. And I've really had the pleasure of working with Dr. Jessica Foley and the Focused Ultrasound Foundation over the past year to educate about and advocate for focused ultrasound therapy. This technology is non-invasive and non-pharmacological and really has a huge potential to positively impact patient outcomes across a whole host of diseases, many of which impact our veterans and service members. So thank you again for joining us today. We're happy to have you. To start us off, I would like to welcome Senator Mark Warner of Virginia to share some opening remarks. Senator Warner was elected to the Senate in 2008 and was re-elected to his third term in 2020. He serves on the Senate Finance, Banking, Budget, and Rules Committee and is chair of the Select Committee on Intelligence. The senator has been a champion of focused ultrasound therapy and the Focused Ultrasound Foundation since its inception, and we are really grateful for his support and are delighted that he was willing to share some remarks with us today. So here is Senator Warner.
Hi, I'm Virginia Senator Mark Warner, and I'm very proud to lend my support to the efforts to bring more focused ultrasound procedures and technologies to the forefront. I'm very proud that the Focused Ultrasound Foundation is located in Charlottesville, Virginia, and my dear friend, Dr. Neil Cassell, has been so active in focused ultrasound. I've been proud to be a donor to that foundation. I am so excited about the enormous number of opportunities that focused ultrasound provide in terms of a non-invasive way to potentially solve a host of challenges. Alzheimer's, mental health issues, cancer-related issues across the board. So my hope is with this congressional briefing, we can bring the potential of focused ultrasound to more policymakers, and that we can continue to push the FDA and other licensing organizations to make sure that the clinical trials take place in focused ultrasound becomes more of a tool to help so many Americans cure so many enormous medical challenges. Good luck, and I look forward to working with you for many years to come. Hi.
So thank you so much to Senator Warner for his remarks today. I'd like to introduce our panelists that we are so excited to have with us to speak from several perspectives around focused ultrasound therapy. I'll introduce them all briefly now. Dr. Jessica Foley is the Chief Scientific Officer and Managing Director of Government Affairs at the Focused Ultrasound Foundation. Thank you for joining us, Dr. Foley. We have Beverly McGowan, who is an essential tremor patient and a family nurse practitioner for veterans. Welcome, Beverly. Thank you so much. We have Dr. Bucknor, who's Associate Professor of Radiology at the University of California, San Francisco. Thank you, Dr. Bucknor. And Dr. Noah Phillip, who is the Associate Professor of Psychiatry and Human Behavior at Brown University and at VA Providence. So thank you, Dr. Phillip. And with that, I'm going to turn it over to our first speaker, Dr. Jessica Foley. Take it away. Thank you.
Thanks, Katie, and thank you all for joining us. Also, thanks to Senator Mark Warner for his longtime support for the Focused Ultrasound Foundation and for Focused Ultrasound. We're honored to have him kick off this briefing. As Katie mentioned, I'm with the Focused Ultrasound Foundation. We are a 501c3 organization that is dedicated to advancing the development and clinical adoption of focused ultrasound for a wide variety of clinical disorders, which we'll talk about today, a lot of which can definitely be beneficial to our service members and veterans. And so we'll highlight some of those. So you may be wondering, what is focused ultrasound? So I know you're all familiar with using ultrasound for diagnosis purposes, for imaging, but this is using ultrasound for therapy. And this is a non-invasive use of the technology for therapeutic purposes. So we really see it as an alternative or a complement to more conventional forms of therapy like surgery, radiation, drug delivery, and immunotherapy. And focused ultrasound really has the potential to transform treatment for many patients and ultimately transform their lives. So if we go to the next slide, we'll see the main benefit, as I alluded to, was that focused ultrasound is non-invasive. So this means it's most likely or most often an outpatient procedure, so patients can go home within a couple of hours of treatment. There's no incisions, which means less pain. So in most cases, this is limited or no need for post-procedure pain meds like opioids, and overall decreased complications, things like infection, because again, there's no incisions. And so patients can recover much more rapidly than many other conventional procedures. Patients overall see improved outcomes as well as a lower cost to our healthcare system, again, because this is non-invasive and an outpatient procedure. So here's just a snapshot of how focused ultrasound is currently being used today. We've now seen over 450,000 patients treated globally using focused ultrasound technology. There have been there's about 94 indications that are in some form of clinical research and 104 that are in preclinical research. But importantly, 8 focused ultrasound applications are now FDA approved. And I'd like to highlight essential tremor. We'll hear more about that later. Also, some conditions that cause pain, bone metastases and osteoid osteoma, as well as conditions that we're all familiar with, Parkinson's disease, prostate cancer, and uterine fibroids, which definitely have a big impact on many Americans, as well as, of course, our veterans and service members. So how does focused ultrasound work? So this little video shows you, it's very analogous to how a magnifying glass would focus beams of sunlight onto a leaf and burn a hole in the leaf. Except in this case, we're converging many different beams of ultrasound at a spot deep in the body, like a tumor, for instance. And at that spot, we're getting enhanced heating that can cause disruption of the tumor cells, killing the tumor cells. But what's important here is that everywhere along the beam path between, the tissue that we pass through on the way to the target, whether it is skin or muscle or fat, all of that is not going to be impacted by the energy. It's only going to be at that point of convergence that we're going to get a profound tissue effect. So this slide, I think, really best illustrates the real potential of, or not the potential, but the promise of focused ultrasound today. And this is a patient suffering from essential tremor. You can see how disabling the tremor is, how difficult it is for him to move these jelly beans from one container to another. He was actually an architect, and this caused him to be unable to work. You'll see in the next slide how he also has a difficulty drawing, and this was before the procedure. Then you'll see in an MR image, this blue region, that's the region of the brain known as the thalamus, which is actually where the essential tremor is originating from. So there are just erratic cells there that are causing the firing, erratic firing that's causing the essential tremor. And so that's where the neurosurgeon will target over 1,000 different beams of ultrasound just to that small spot deep in the brain to kill only the cells there to get rid of the tremor. And while this is done, the patient is again awake, no anesthesia, again, no incisions. So there's no chance of infection or all those other complications. You can see in the MR image immediately following his treatment, this dark region by the red arrow, that is the small region of cells that were deadened to get rid of the tremor. And that's all that was needed to get rid of the tremor for this patient. You can see afterwards how easily he can draw. And then finally, at his follow-up procedure, how easily he can move these jelly beans from one container to another. So this is very powerful. You'll hear from Beverly as well, her story of being treated for essential tremor. But this was a very exciting clinical trial that started several years ago at the University of Virginia, and then was extended to many different sites around the world for a larger trial, and ultimately was approved by the FDA in 2016 and is now reimbursed by Medicare in all 50 states. But as we'll talk about a little bit later, it's not always a quick path from FDA approval to reimbursement. And so it did take several years between FDA approval to get that reimbursement for several other, for patients all around the country. So kind of flipping to another side of conditions, focused ultrasound can also be used for treating many different cancers, and hard to treat cancers, particularly like pancreatic cancer or like glioblastoma. So you can see here that this is a patient with pancreatic cancer. There's a very large tumor that is shown in the yellow circle. And you can see in the next image in the middle, the dark region is the region that was treated by focused ultrasound. So as the tissue is, or as the cells are killed, the region shows up dark. And then you can see that over time, the deadened tissue resorbs into the body. And this is why you see a smaller mass in the last picture. What's important in the next slide is that there was actually an impact on metastatic tumors, not only just on the primary tumors for a handful of patients. So this is suggesting that there's a potential for a systemic response to focused ultrasound treatment. This is very exciting because it would mean that perhaps you could treat a primary tumor and then get an effect throughout the body. And so that's something that could really benefit from more research funding, is to better understand the origin of this systemic response, this immune response that's being created by the focused ultrasound. And so we'll talk a little bit more about that later as well. So one, very important thing about focused ultrasound is that it is precise and accurate. So there's a sharp demarcation between treated and untreated tissue. You can see here, as evidenced in the liver and the brain, there's about 1/10 of a millimeter separating treated and untreated tissue. And what's important about that is that, oftentimes physicians would want to treat something in the body that is right up next to something that's very sensitive that they don't want to treat, such as a blood vessel or a nerve. That may be the case in the liver for treating a liver tumor, for instance. Or in the brain, all the tissue is sensitive. So if you're treating a region that's causing essential tremor, you want to make sure that you're only treating that region and not treating regions nearby that may impact speech, for instance. So on the next slide, this is just evidence or showing you that there are many other ways beyond that targeted heating that focused ultrasound can be used to treat tissue in the body. One of those is by enhancing localized drug delivery. So there are several ways that you can do this, but what's important about it is that it really enables the precise delivery of higher concentrations of drugs only where they're needed, lowering the systemic toxicity of things like chemotherapy. So this would be really important for patients who tend to suffer a lot from those systemic toxicities. And then also, as I alluded to, focused ultrasound can promote or enhance the anti-cancer immune response. And, what this means is that, tumors are pretty good at camouflaging themselves from the immune system. And focused ultrasound can destroy that camouflage by disrupting the tumor cells, exposing antigens, and releasing proteins that then the immune system can recognize and begin to attack the tumors. So we really think this has a lot of potential to enhance the effectiveness of immunotherapy drugs. And that, again, is where one way in which more funding for research into focused ultrasound would really help to move this field forward, to bring new treatments to patients. So as was mentioned, there are many different clinical applications in development. There's actually more than 150 of them. So of course, we can't go into all of those, but what's important to note is that several of them, as I mentioned, are FDA approved. So the ones in this chart with the red arrows, those are FDA approved. But you'll notice that there's only a few of those red ones that then have these purple arrows indicating that they have widespread reimbursement in the US. So again, there is often a big lag time between FDA approval and reimbursement. And that's a significant challenge where patients are seeing that this is an approved therapy, but yet they don't have access to it. So we're really looking to all of you to help us in breaking down those barriers to get more patients access more quickly. What's also important to note here is that there are many applications that are very early stage. They only have a couple of arrows next to them. Those are the ones that could really benefit from more research funding. And you'll notice, it may be hard to read, but you'll notice several of those will be highly relevant to our veteran and service member populations. Things like, depression, pain, various types of pain, traumatic brain injury, post-traumatic stress disorder. So we'll hear some more about some of those applications from our physicians, and where we stand with those right now and where we could go if we had further research funding. And it also, should be noted that there's promising research and treatments occurring at major sites around the world. This is just a snapshot of some of them, some of our centers of excellence, but we, really are seeing tremendous research going on, pretty much all over the country, most of the states, and definitely throughout the world. And so again, that's what we're trying to continue to promote through further research funding. So despite all of this, really exciting, promising research that is going on and things that are approved, we still have several barriers to really getting it full advancement and adoption of focused ultrasound. So there's three key areas. One, there's still a lack of awareness of focused ultrasound and its potential among policymakers and funding agencies. That can be an issue when people are applying for research grants to, whether it's the NIH, whether it's the CDMRP program and DoD. They may be coming up against program officers that really aren't familiar with focused ultrasound and have a difficult time assessing it because of that unfamiliarity. So the more awareness that there is about focused ultrasound at all of these funding agencies, we really feel is going to be helpful in them being able to make the best decisions about grants and focused ultrasound that come into those agencies. There's also a lack of insurance coverage and reimbursement, even for FDA-approved treatments. And this is really limiting patient access to promising therapies. You'll hear from Beverly, her story, but there were several years when Essential Tremor was FDA-approved, but not yet reimbursed by Medicare. And so patients all over the country were having to pay out of pocket for that treatment, which of course is not a possible thing for most patients. And that really limits the access, particularly the equitable access. And so that's something that we're really looking to Congress to help with in terms of improving insurance coverage. And then finally, the research funding piece. We've talked about all these great applications, but many of them need significant funding to advance the new innovative treatments, and particularly those for conditions that are prevalent in our veterans and service members. And I'm just going to highlight a couple of examples. One is the treatment of uterine fibroids. This is a treatment that's been FDA approved for 17 years, but yet it's still rarely covered by private insurers. And it's also not often covered by CMS or VA or TRICARE. And so this is a procedure, being treated with focused ultrasound, again, is non-invasive. Women can get back to work the next day, compared to conventional treatments where they may be out of work for several weeks. So we think all women should have access to this treatment, but yet it is not covered by insurance. So that's just one example of the challenges that we face in the insurance realm. And then when it comes to research, one example that will get highlighted further is chronic pain. So obviously we all know someone or ourselves who suffer with pain. 44% of deployed soldiers deal with pain, and 15% of them report regular use of opioids, which is of course not the desired treatment modality for anyone, particularly those who are in our military. And pain in general is costing over $560 billion a year in healthcare costs. So here's a treatment of a non-invasive, non-pharmacologic treatment option for pain. Just the fact that it's non-invasive can mean that that patients don't need to go on opioids in the first place. but as you'll learn, it also can be a treatment itself for pain, and it gets patients back to work and daily life quickly. But again, it needs much more research funding. And so these are just a couple of examples of where we really need your help. And so I'll just leave you with that. You know, there are several ways that Congress can really take action. Obviously, in research, Congress can help to increase funding for focused ultrasound through the NIH, the VA, and the DoD, including the CDMRP program. Congress can also help with access, enabling timely reimbursement of focused ultrasound for all patients via CMS, TRICARE, the VA, and private insurance. And finally, education, just raising awareness. You know, we're doing that with you now, but also you go out and tell the story to raise awareness of the power and promise of focused ultrasound. So again, thank you for being here. We're really looking forward to being partners with you as we move forward to advance this powerful treatment.
Thank you so much, Jessica. I really appreciate that introduction to focused ultrasound and the many ways that it can help patients. With that, I'd like to turn it over to Beverly McGowan. She is an essential tremor patient and also a family nurse practitioner who's cared specifically for veterans throughout her career. So Beverly, over to you. Thank you for joining us today.
Thank you very much. I'm joining you from Western Montana, where I work as a family nurse practitioner and served veterans in our VA clinic for over a decade. I have the unique perspective of personally experiencing high-frequency ultrasound treatment for the condition of essential tremor, and then continuing to work with veterans and other patients as a healthcare provider who have health conditions that can be improved with this treatment. Many of you may know someone with tremors, either from Parkinson's or essential tremor. Essential tremor affects about 7 million people in the United States and usually affects the upper extremities, but also very commonly can affect the movement of the head and speech. I likely inherited my condition from my father, who's a World War II veteran, who was unable to be involved in combat because of his tremor, which prevented him from steadying a rifle. He eventually was not able to dress or feed himself independently. My symptoms started with an involuntary movement in my right index finger. I took a medical leave of absence from the VA in Missoula in 2017 because of my essential tremor symptoms, which had progressed to the point where I could no longer do an adequate physical examination, type up a report, read my handwritten notes from an assessment that I may have completed. Outside my work, my symptoms became so severe that I could no longer enjoy my favorite hobby, doing photography. I quit dining out in public. I passed on family reunions and other social engagements. My medical leave of absence from the VA turned into retirement in about 90 days later. As I searched for answers for managing my symptoms, I knew that the current pharmacological and surgical options were for my condition from treating essential tremor in my practice. But I was looking for new technologies that were available and would provide better outcomes with fewer risks. I eventually came across some research from Stanford about using an MR machine to guide high-frequency ultrasound waves into the thalamus gland deep inside the brain. And this sounded very promising. I had found my answer. Now I'd like to move forward about 14 months to early fall in 2018. I had returned to work as an independent contractor nurse practitioner and was in my first week of conducting health assessments on patients and veterans in their homes. Just 8 short weeks earlier, I had been at Stanford in an MR machine, having high-frequency ultrasound painlessly resolving my tremor. I was calling on a veteran in his 70s in his home here in Western Montana. And as I sat at his dining room table, I was enjoying the beautiful pieces of artwork around his home pen and ink drawings, oil colors, acrylics, and most impressed with some beautiful bronze sculptures that were very lovely, nicely placed around the room. We had been together for about 50 minutes doing a health assessment, reviewing his health history, his conditions, his medications, et cetera, et cetera. And I had noticed during the examination that when he picked up a pen to jot down a couple of notes, his hand was shaking quite obviously. And when he spoke, at times his head would bob involuntarily, and there was a little bit of a tremor in his voice. But it was interesting to me that he didn't bring up these symptoms or mention anything about a tremor going through his health history. So I asked him about his tremor symptoms, and he said that he had been diagnosed with essential tremor about 10 years earlier and had tried some medications that did not show him much improvement. He did not want to take medications long-term, especially if they really weren't giving him any benefit, and was not comfortable with the risks and reported outcomes of surgical options. He had become accustomed to not even bringing up the condition of essential tremor when he talked to his healthcare providers because he was pretty well firm in the idea that there was nothing else that was available for him. At that point, I stopped my assessment and asked him if I could share something personal with him, and he agreed. And I looked at him and I said these words: I have essential tremor also, and I was just treated 2 months ago in an MR machine that resolved my tremor. He kind of laughed at me and he says, you know, I sat here with you for 45, 50 minutes, Beverly. And he says, and I've watched you type on your iPad and your computer and take notes, handwritten notes. And he said, lady, I can tell you, you do not have the same condition I do. And I said, well, I'd like to show you something. So I pulled out my cell phone and showed him this short video.
Thanks, Bev. I'm pulling it up now. Give me just
Thank
a
you.
moment. Yep.
Thank you. This is me attempting to take my vitamins in the morning. And the video is not quite running up to speed, but my tremor was quite extensive and I couldn't really get the bottle of water or the glass of water up to my mouth. And this is me in the Stanford recovery room, just moments after receiving that treatment. I looked at the veteran that I was talking to, and he was just staring at the phone, and big tears started forming and falling down his cheeks. And once he was able to compose himself after a couple of moments, he looked at me and he had two questions. How do I get this treatment? And why didn't my doctor tell me about this? You see, all the pen and ink drawings and the watercolors and the acrylics and the beautiful sculptures were all his life's work. He was also a chef, used to be a chef, and he was no longer able to work as a chef or do his favorite pastime, which was cooking for his friends and family. He had not held a sculpting knife or a watercolor brush for almost 10 years. I spent a few minutes with him and told him about my procedure. And I offered up the following benefits that I experienced, both as a patient and as now a provider, once again, working as a nurse practitioner. The high frequency ultrasound treatment was quick. Mine was a one-time outpatient treatment. It's very effective. Essential tremor symptoms are shown to improve between 70 and 95% in 50 to 70% of the individuals who have this procedure. The effects are long-lasting. My improvement in tremor was 98% at the time of the procedure and is holding at 96% improvement now, 4 years later. And the low risk of the side effects and quicker recovery time that is inherent in surgical procedures. The side effects of my procedure were a little bit of gait imbalance and some foggy thinking. These symptoms resolved dramatically within 2 weeks after the procedure and virtually were gone within 3 months. Nowadays, when I speak with patients who have a diagnosis for the condition, have symptoms, or know a friend or family member who has symptoms, I show my little video and share my story. I do this on airplanes, in restaurants, sitting in my primary care physician's office waiting room, and tears of joy continue to flow. I have made appointments with neurologists and neurosurgeons and radiologists in my area to go see them on my time to share this exciting therapy option. A longer version of my before and after video is posted on Stanford's neuroscience website, and I continue to receive emails and phone calls and share my story with people from all over the world. I am here with you today to impress upon you the value of this technology in changing people's lives from being virtually disabled to becoming once again vibrant, productive citizens. Education is needed for both medical providers and patients. Because I'm a healthcare provider, I was motivated to search beyond the current medical options. Most individuals are not motivated in this way and rely on their providers to offer them solutions for their healthcare needs. Medicare has now improved reimbursement for ultrasound therapies in all 50 states for essential tremor. However, the reimbursement path is woefully slow and cumbersome, taking over a year in some places for patients to realize the reimbursement. In 2017, my funding for I did crowdfunding for my treatment at Stanford because my Medicare coverage and my Federal Blue Cross Blue Shield insurance company at that time did not cover this procedure. Our veterans need access to this care. The VA facilities and clinics need the funding for the equipment and trained staff to administer these therapies. In 2017, there were only 4 facilities in the US who offered the treatment. So I had to travel over 1,000 miles from Montana to Stanford to receive my care. Most patients are not able to manage these expenses. I will continue to tell my story to my colleagues and patients whenever possible. And I want to end my tale from now on with the good news that the treatment is available for them in their area. I want to thank you for your time today. Focused ultrasound is a leading edge and exciting technology. It works, it's cost effective, it changes people's lives. Thank you, and I wish you good health.
Beverly, thank you so much for sharing your story with us, hearing the patient impact of this technology, going beyond the science to understand how it affects patients in their daily lives and the challenges that come with obtaining that treatment is very helpful today. So thank you so much. We appreciate you. And with that, I'd like to turn it over to Dr. Matthew Bucknor, who will be our next panelist. He's here from the University of California, San Francisco today. Dr. Bucknor, thank you so much.
Thank you very much for that introduction. I'm going to go ahead and share my slides. I just want to echo, thank you so much, Beverly, for sharing your story. It's very moving. I want to talk to you today about pain, about why we have an obligation to do more for patients suffering from pain, as well as why and how focused ultrasound can be a game changer for a medical approach to this condition. Each and every one of us is going to experience physical pain in our lives, whether or not it's a young active service member or an aging veteran, whether or not it's my 6-year-old son telling me last week about a new pain in his thigh, or my parents in their 70s calling me and sending me images for the inevitable range of pains that we will all face as we get older. No one gets through this life without having pain. If we're lucky, those episodes of pain are short-lived, but for many, moderate and severe pain is chronic and debilitating. Pain is deeply embedded in our humanity, and in a way, it's part of what makes us human. But that doesn't mean we should live with endless pain if we don't have to. As a musculoskeletal radiologist, I spend every day reviewing images of between 1 and 200 patients who are trying to explain their pain, and I perform image-guided procedures that hopefully will allow my patients to walk out the door with less pain than when they came in. I'm not going to belabor this slide. Back in 2010, the National Academy of Sciences estimated the cost of managing chronic pain to be between $560 and $635 billion per year. 12 years later, we are surely nearing a $1 trillion industry. And what are we using that money for? Well, mostly we are still fighting 21st century pain with 19th and 20th century technologies. We're all very familiar with these. These are the non-opioid medications like ibuprofen and other non-steroidal anti-inflammatory drugs. There are also drugs designed to modulate nerve activity like gabapentin. There are more invasive approaches like surgeries and other procedures to directly reach and try to eliminate the source of the pain. And there's radiation, where we hope we can kill a pain generator without killing too much of the normal tissue that surrounds it. And then, of course, there's the elephant in the room, the opioid industry, medications which have unleashed a plague on this country of horrific overdoses and countless lives lost too soon. How is it that with all the advances of modern medicine, we don't have something better? Well, the answer is, of course, we do. Our country has the greatest innovators on the face of the planet, but despite the billions spent on medical research each year, we're not prioritizing innovations and technologies that enable us to take major leaps forward. Focused ultrasound, this is the device that I use at UCSF, is one such technology which deserves your undivided attention. These are CT images of a 23-year-old man with a small benign tumor on a bone in his leg. Now, this tumor, we call it an osteoid osteoma. It's kind of a silly name, but that's what we call it. It's very tiny. It typically affects adolescents and young adults. Usually these are about 1/2 inch in size, so they don't metastasize. They're not going to destroy the bone. This is not cancer. They seem to have been invented for one reason and one reason alone, which is to cause pain. These tumors not only increase the nerve endings in the bone, they also actually pump out hormones that directly feed into our body's pain pathways and recruit massive amounts of inflammation and swelling, worse than what I see sometimes in traumatic injuries. Patients report pain levels of 8 or 9 on a 10-point scale, and the classic history is that the pain is so severe at night, it wakes them up from sleep. To get through their days, they have to take ibuprofen on carefully coordinated schedules, indefinitely, just to be able to focus at school or at work and do the normal activities that we all sometimes take for granted. Treating these patients with focused ultrasound is a game changer. Many years ago, the standard of care therapy would be to cut this spot out, but that can leave the bone weakened, susceptible to fracture, and cause local damage. More recently, the most common treatment is to actually drill a hole through the bone into the tumor, and through that tract, insert a thin probe and get the tip of that probe very hot. It works. I actually do this a few times a month, but again, there's a risk of bleeding and infection and fracture. So we tell our patients who are typically very active that they need to slow things down for a significant time to allow everything to heal. It is only in focused ultrasound that we have a precise therapy that is totally non-invasive, offering the possibility of decreased recovery times and long-lasting relief. With this technology, we can both target the abnormal spot in the bone as well as the nerves embedded within the outer shell of the bone to successfully treat pain in these patients. This is absolutely one of my favorite procedures to do. Patients come in with severe pain, they leave a few hours later, and within a few days when I follow up, there are often tears of joy that this debilitating pain could be completely eliminated so quickly and non-invasively. Tears of joy that the patient can return to running and other sports and all those things they used to do which fulfill them, but they can get back to being the person they had always been before their lives were at the mercy of their pain. The thing is, treating pain related to focal lesions is just the tip of the iceberg for focused ultrasound. We can use these same principles and apply them throughout the body. Researchers around the world have made groundbreaking progress to advance this technology in the last few decades. And everywhere they have looked, they have found new possibilities of alleviating pain with focused ultrasound. In the musculoskeletal system, we know that this technology has shown promise for treating pain from the facet joints in the spine and from the sacroiliac joints in the pelvis, and even pain from degenerative changes in the knees and other commonly affected joints. There are regulatory approvals for this technology to treat back pain in Europe, in Asia, South America, and Oceania, but not in the United States. There are hospitals in Europe, in fact, where the use of this technology is so commonplace, patients are just coming through with severe back pain. They get this treatment, they stay overnight for observation and leave the next day on the road to a life with less pain. The promise of ongoing innovation combining this technology with existing medications is extraordinary. Just down the road from UCSF at Stanford, one of my close friends from medical school, Dr. Rag Aaron, has developed an incredible technique where he can put common anesthetic medications like lidocaine, like what you get when you go to the dentist, into these very, very small nanoparticles. The nanoparticles can be introduced intravenously. And at this point, they're just sort of flowing through the bloodstream and nothing happens. They'll get passed out of the body harmlessly if we don't do anything else. But he has been able to combine these caged particles with focused ultrasound to selectively release lidocaine anywhere we can get the sound waves in the body. The energy from the sound waves pops the bubbles, and wherever we aim the sound, the lidocaine gets released. This means we can selectively turn off nerves almost anywhere in the body. We can do totally non-invasive nerve blocks. In fact, we can selectively turn off parts of the brain, but I'm going to defer to Dr. Phillip to discuss more of the incredible neurological and psychiatric applications. The possibilities are seemingly endless if we are brave enough to push beyond conventional approaches and fully recognize the promise of this breakthrough non-invasive technology, which is sitting right in front of us. Carving out this path forward is hard work. How can we fully realize the possibilities of this moment? Well, 3 things. First, we should improve federal funding for research and technological development. Second, we need to remove excess regulatory burden. And third, we have to create a more efficient pathway for reimbursement by Medicare and other insurers. If you believe me that this technology is as great as I'm telling you it is, I'm sure it's hard to believe that uptake hasn't been more widespread. But as you know, in our wonderful and uniquely American system, there are always forces working to defend the status quo, entrenched interest groups that promote a pathway filled with tiny incremental steps instead of investing in the rigorous science that we need to understand how to best use a groundbreaking technique like focused ultrasound. Directed investments by the federal government can change these dynamics and promote a more equal playing field so that the best technologies win out and patients get the best possible care. The government can also work to make sure we have only the regulations that we need, not ones designed to crush the pursuit of science. One of the first studies that was approved in the United States to study focused ultrasound for back pain had to be eventually withdrawn, in part because our regulatory bodies insisted on inclusion criteria that were so strict and extensive that the study was really only allowed to enroll patients who did not actually exist. And what I mean by that is that the combination of patient characteristics in terms of the way their spine had to look was something that we only see once in a blue moon. Those sorts of regulations drive great clinician scientists away from academia and make it difficult for us to realize the promise of this technology. Finally, if at the end of the day, there's no efficient pathway to reimbursement, there's really no path forward. On a closing note, I want to highlight that the federal government has an important role to play here in terms of health equity as well. I did a study recently that looked at how we were using a new state-of-the-art imaging technique for prostate cancer. It's known as PSMA. And access was only available for several years to this new technique through research trials. And we found that Black patients, at least our institution, had nearly 4 times reduced access compared to white patients. We looked at race and socioeconomic status and a whole slew of other demographic factors. And this difference for Black patients was the only thing we found. We know that there are barriers for patients to access these kinds of emerging technologies. By expediting groundbreaking and rigorous science, we can help to ensure that the promise of these technologies is available for all Americans. Thank you so much for your attention.
Thank you, Dr. Bucknor, and thank you so much for introducing that equity angle there at the end. That is very, very important and certainly something that needs to be discussed as part of this conversation. So thank you so much. Our final panelist, Dr. Noah Phillip, is here from Brown University and VA Providence. Welcome, Dr. Phillip. I'm going to get your slides up in just a moment.
Sounds good, and thank you.
Yeah.
So as these are coming up, let me just, before I say anything else, I wish to say, so I am a federal employee. So that means that my appearance here really is my personal capacity. So not as a representative of the U.S. Department of Veterans Affairs. And really the views expressed here are my own and don't reflect the opinion of the VA or really any of the agencies that fund my research. So I am here to talk to you about the promise of focused ultrasound for mental health. You've heard wonderful things thus far, both from patients and from other researchers and clinicians. And I think that the promise really here cannot be overstated. And while we pivot here, I want to just remind us that the impact of depression, of anxiety, and post-traumatic stress really cannot be overstated. So as a psychiatrist, I see the impact and destruction that these illnesses wreak on my patients and their families. And my mission is to design, develop, and deploy new treatments that get people better and back to their lives. So I think we can all agree that the current mental health treatments really do not meet our needs. You heard a little bit earlier about the challenges with opioid and pain medications, and we have something similar in mental health. So while we do have medications that work, they often don't work as well as we need them to. And furthermore, they can come with some significant side effects. Other treatments that we have, psychotherapy, that's talk therapy, it's also effective, but can be hard to access and may not work for people who don't want to talk about their trauma. We have other treatments using magnets or electricity. Those are also effective, but they can be incredibly expensive, very difficult to access, or heavily stigmatizing. So really to pivot here, I'm going to be talking about focused ultrasound in mental health. But before I do so, just permit me a little bit of some background so you understand the context of which that we want to be using this promising technology. So here I want to talk to you about a part of the brain called the amygdala. And Katie, I will ask you to move to our next slide, please. All right, so there in orange is the amygdala. And so you may remember from science classes or from otherwise that this is the part of the brain that's involved in the fight or flight response. Now, as a simple example, when service members are in combat, right, this is the part of the brain that helps keep them alert and helps keep them alive. And yet, if we ask too much of this very small and almond-shaped part of our brain, it becomes stuck in an on position. And once the amygdala is always on, it causes problems. And what I mean by that is it starts seeing threat and danger once people will come back after service, so when they're trying to come back to their lives. And this is not just a problem for veterans. So if the amygdala is stuck on, it can cause problems for everyone. And this can happen after stress or other terrible things that happen, unfortunately, in the course of daily life. The long story short is an overactive amygdala means that bad things feel more relevant and can lead to depression, can lead to anxiety, and can lead to post-traumatic stress. So what we are doing at VA Providence and with funding from the National Institutes of Health is studying whether we can use a low-intensity focused ultrasound to reach inside the brain and very gently turn down the amygdala as if we had a dimmer switch. And let me show you what this looks like. So we'll move to the next slide. And we'll start the video. And I want everyone to look right at the center of this cup of water. So there's a little dimple there, right in the very, very center of that cup of water. This gives you an idea of how gentle this ultrasound energy can be and also how precise it is. So we are talking about less than 1/8 of an inch of precision, and no other technology exists with this kind of ability. So what we're doing is testing and evaluating to make sure that this can be as safe as possible and lay the foundation for other studies that will test how and best to use this in mental health. I'm going to ask you to move to the next slide, please, Katie. Thank you. So here's one of our staff members demonstrating what it's like to wear one of our ultrasound devices. I have to admit, this is not the most attractive hat on the market. It looks a bit like a hockey puck on the side of someone's head. And to administer this, we target the device while people are inside of an MRI scanner. I'll have you move to the next slide. And I want to show you here what it looks like when we're targeting this device. You'll see a little blue line and a little green line, as well as what's going to look like a target. And this is going to show you the precision of what we do as we are doing it. So what we're looking at here is someone's brain. Yep. And if you want to move to the next slide, it'll be even clearer. So just to orient you, that top left is that hockey puck you saw earlier. And the other panes show me that the beam is going exactly where we want it to go. Again, underscoring the precision of this technology to reach in and very gently and safely turn down the amygdala. So this line of study really is transformative. It's a totally new way to non-invasively help patients with depression, with anxiety, or post-traumatic stress. My work, my efforts really as part of a tremendous team is to show that it is safe and, as I hope, effective. So that all said, why I'm here today. So what you have seen here is a tremendously expensive process. And there have been multiple regulatory, I will say, impediments that do make the process very slow. And everything you've seen here has been a product of an incredibly hardworking team at VA Providence and at Brown University, and I believe many of whom are on the line today. So it's my hope that after you hear what we have to say, that Congress and various other agencies can be thinking about ways to increase funding for this kind of research and make it easier for those of us in the research community to bring this technology to the present. So in closing, so as a psychiatrist, as a physician, as a researcher, our goal is to get patients back to their lives. This focused ultrasound technology has tremendous potential to revolutionize how we think about mental health treatment, and for the first time be able to safely and non-invasively reach into the brain and gently turn down a core part of the brain that's involved in everything that we see and treat on a daily basis. No other technology has this potential. And with that, I will close, and I appreciate everyone's time and attention, and I really do hope that you'll support our efforts.
Thank you so much, Dr. Phillip. Very much appreciate your presentation. I'm going to turn it over to Jessica Foley to close us out with our call to action, and we'll move to take a few questions. So over to you, Dr. Foley.
Well, thank you for all the panelists for just really inspiring stories, and then also showing us the true value that we can add to patients' lives, particularly our military and veterans with focused ultrasound. So I just want to drive home our key points here. You know, again, we're looking for increased federal funding for focused ultrasound research through all the different agencies, NIH, VA, and DoD, particularly CDMRP program. We're looking for your help for enabling timely reimbursement of focused ultrasound so that all patients can have access to this powerful technology and these new treatments, and that is through via CMS, TRICARE, the VA, and private insurance options. And again, continuing to educate members of Congress, to educate those in the federal agencies and everyone to really raise awareness of the power and the promise of focused ultrasound. So again, we look forward to partnering with you however we can to help bring this therapy to more patients as quickly as possible. And we'll take some questions if you have any. Thanks.
Thank you so much, Dr. Foley. I'm going to stop my screen share here and just throw out a couple of questions that we've had from folks throughout the presentation. I know Beverly mentioned in her work with veterans that veterans specifically, you know, often have a hard time accessing focused ultrasound treatment. And so we had a question as to why are we seeing this technology perhaps underutilized within the DoD and the VA? I don't know if any of our panelists would like to take that question.
I think we don't necessarily know the the full extent of why a lot of our work right now is trying to better or make better connections with the DoD, with the VA, to really try to understand, why is it a lack of awareness, or is there something else that's needed? Is there more clinical studies that's needed, or more evidence? And so we think it's really probably more a lack of awareness and understanding. And so we're really trying to build those connections, and hopefully this can help, as well as, again, input and connections from policymakers to really help to drive home why this is something that the VA should take a look at if they haven't already.
Thank you so much. We've also had questions about, are there any long-term effects or side effects of focused ultrasound that patients should be concerned about if this is a treatment that might be available to them? Anybody?
I mean, I can take a stab at some of the procedures that I do, and certainly I haven't seen any long-term side effects to be worried about or concerned about. And especially when we compare to the standard of care treatments like invasive procedures and needle-based procedures, it just feels like across the board consistently that there's less risk of any kind of significant long-term side effects. And I think that just sort of echoes, though, the what we've been saying throughout this presentation is the need for more funding to be able to study this longitudinally is really, really important. It's a newer technology, and we want to make sure that we're studying it as carefully as possible.
Thank you so much. Another question that came in, is there any specific legislation under consideration, or do we need legislation to assist the use of technology to better focus on pain and reduce opioids? I'll chime in, and I think that one of the things we're most excited about with focused ultrasound technology is that it's a non-pharmacological treatment, that it does help avoid opioid addiction and provides an alternative to that. Someone else had asked another question about legislation. That's really something that we're working on the government relations side, both specifically from a funding perspective and from a coverage perspective. And legislation in that respect is certainly an option and something we're thinking about as well.
And I would just add that there are other legislative tools that could potentially bring focused ultrasound to patients more quickly. There are different pieces of legislation under consideration for reducing the time between FDA approval and CMS Medicare coverage, particularly for breakthrough innovative treatments like focused ultrasound. So we're trying to highlight some of those pieces of legislation as well as many other administrative or the initiatives of the current administration, things like the creation of ARPA-H, where there could perhaps be true innovative research in focused ultrasound that may find a home there versus the conventional programs in NIH. So there really are a lot of avenues where we think that focused ultrasound could benefit, and it's a matter of kind of identifying those and pushing those forward.
Well, thank you so much, Dr. Foley. We're a minute over. I want to be respectful of our panelists' time and our participants' time. To our panelists, a resounding thank you for this briefing, for your time, for this information. Very much appreciated. And to our panelists, thank you so much for joining us. Today, we know everyone is zoomed out, so the fact that we had your attention for an hour, we're very grateful for that. So we will be following up with a recording of this for folks to reference, or for those of us who weren't able to come on but registered to receive. So thank you to our panelists, to our participants, and have a wonderful Tuesday, everybody. Thank you again.
Thank you. Be well, everyone.
Thank you.
Thank you. Good health.